There are almost zero videos on the internet showing what a virtual EMDR therapy session can look like. So today, fellow EMDR therapists and I are going to fix that problem, and if you stick around to the end, I'll even talk about what this has to do with virtual EMDR therapy. We're about to show you the phases of EMDR therapy that probably most people want to see, which is the actual EMDR processing, and doing this as a virtual EMDR therapy session from home. A fellow EMDR therapist, Devin, will be playing the part of a person who survived a car accident, while I, of course, am the EMDR therapist. And just know before we go into this first part that Devin and I have already talked about parts of the car accident and also some of the sensations, emotions, and beliefs around it. And this is what happens next. Okay, so just go ahead and bring up that image of that worst part and the thought that I'm not safe, and noticing where you feel that in your body, and follow that dot. Devin's using an app to follow the dot as it moves repeatedly left and right on our screen, while I manage on my end the start and stop of the dot movement as well as the speed. And this is happening while Devin's focusing on any emotions, sensations, thoughts, or other things that come up for her. And what you probably can't tell is that Devin's actually also wearing some headphones that once the dot hits a certain side of the screen, it'll also play a tone in that same ear, as long as the headphones are in the correct ear, of course. And this is actually a way that some EMDR therapists will have their clients do it, is even just closing the eyes and just listening to the tones. You'll see eventually I stopped the bilateral stimulation and asked Devin what she noticed. And take a deep breath. Let it go. And what do you notice?
My stomach's kind of bothering me, and I feel a little sweaty.
Okay, go with that. Doing great. Eventually, I'll stop the bilateral stimulation and ask Devin what she noticed. And just to show you another form of bilateral stimulation that's commonly used in a virtual EMDR therapy session, we're just going to switch to the tapping. And this is sometimes what EMDR therapists have to do if their client's screen is too small, like if they're using a smartphone for their EMDR therapy session, where we might have to use more of the audio or the more tactile. Deep breath. And what comes up for you?
My mouth is really dry, and I'm kind of more vividly seeing what was going on during the car crash and feeling like my leg is kind of throbbing a little bit, which is where I got hit in the car crash. Yeah.
Okay, notice that. Doing great. Before Devin started doing any eye movements, I asked her how disturbing the car accident memory is to her now on a scale from 0 to 10, where 0 is not disturbing at all, and 10 is the most disturbing she can imagine, and she said it was a 4. So during this phase called desensitization, we're just trying to move that 4 down to a 0, and this is one of the more longer EMDR processing phases, and so you'll see in this next part we move to a 0 and we move into the next phase. And go ahead and stop. Take a breath. What do you notice?
I noticed that I had this image of me around, or in a hospital bed, and there's lots of people around me. Like there was my family, people come in and visit me, and they were giving me gifts, and I just remember that they were trying to take care of me, making sure that I was okay.
Yeah. All right. Now, when you think back to this original memory, how disturbing does it feel to you now, 0 to 10, where 0 is not disturbing at all, and 10 is the most disturbing you can imagine.
It's a 0.
So now just bring into mind that original memory and holding that together with the words, I am safe, and go with that. This phase of EMDR processing is called installation, and what we're doing is transforming the belief that Devin once had about this car accident, and that she still has, the idea that I'm not safe, and transforming that into I am safe, or I am safe now. And go ahead and stop. Take a breath. And what do you notice?
I was thinking about all the times that I've driven, like cross country or different times, and just remembering all those times that I was able to be safe while I was driving and feeling pretty okay.
Yeah. Mm-hmm. Okay, so just go with that. Doing great. At the very beginning of this phase, I asked Devin to rate how true the words I am safe feel to her now on a scale from 1 to 7, where 1 is completely false and 7 is completely true, and she rated it a 6 out of 7. And what we're doing here in this phase is moving that 6 to a 7 out of 7 so that the words I am safe feel completely true. And you'll see here that we reach that 7 and then we move on to the next phase. And stop. And breath. What stands out for you?
That feeling in my stomach whenever I think about it is like totally gone. And I'm starting to feel a little tired and relaxed.
Yeah. Okay. So now when you think about this original experience in the words, I am safe now, how true do those words feel to you now on a scale from 1 to 7, where 1's completely false and 7's completely true?
I think it's a 7 now.
All right. So now what I'd like you to do is just close your eyes and bring up the original memory and the words, I am safe now. And without tapping, just telling me, what do you notice in your body? Like, what sensations do you feel inside?
I noticed that I still have a little bit of like a twisting feeling in my stomach. So there is still some disturbance.
Yeah, okay. So just go ahead and go with that, and we'll continue the faster tapping. This phase is called the body scan, and first we're clearing out any uncomfortable or painful sensations that Devin's experiencing, and then you'll see that after we do that and Devin feels better, we do something a little different. And go ahead and stop. And deep breath. What comes up for you?
Like I feel like the absence of any kind of like twisting or pressure just feels light. It feels good.
Yeah. Okay. So now what we'll do is just have you do that slow tapping as you notice that. So go ahead and go with that. Towards the end of this virtual EMDR therapy session, Devin is using the slow tapping to help strengthen any of the more desirable sensations she's experiencing. And after some strengthening, then our target is cleared. What some virtual EMDR therapists will have people do is buy something called tappers. They look like this, and basically what someone will do is just hold one in the left hand, one in the right hand, and it makes a little vibration, just like a cell phone, where one side will vibrate and then the other, and back and forth. And the same thing can actually be done with a video game controller. Some virtual EMDR therapists will have a web app that allows them to connect their client's video game controller to their Bluetooth, and it'll vibrate left and right and back and forth. Of course, EMDR therapy should only ever be done with a trained EMDR therapist. No one should ever try to do it on themselves. Otherwise, I hope you found it helpful to watch this example of a shortened virtual EMDR therapy session And if so, I hope you'll like and subscribe, which will let you know in the future when I put out a new counseling or mental health video. So what's something you find interesting about virtual EMDR therapy? Just leave me a comment in the comment section below. And if you'd like more information on EMDR therapy, just click right up here on this video where I answer the questions, what is EMDR therapy and how does it work? I'll see you in the next video.